Well, hey, everybody, this is Robert, and welcome to today's Outbreak newscast. Now, in India, the Ministry of Health and Family Welfare reports since early June 2024, acute encephalitis syndrome cases have been reported from Gujarat in children under the age of 15. Now, health officials report as of July 31st, 148 AES cases. That includes 140 from 24 districts in Gujarat, 4 from Madhya Pradesh, 3 from Rajasthan, and 1 from Maharashtra have been reported, out of which 59 cases have died. Chandipura virus has been confirmed in 51 cases. Now, a declining trend of the daily reported new cases of AES is evident since July 19th. Some good news there. Gujarat has undertaken various public health measures such as insecticidal spray for vector control, EIC, sensitization of medical personnel, and timely referral of cases to designated facilities. A national joint outbreak response team has been deployed to assist the Gujarat state government in undertaking public health measures and for conducting a detailed epidemiological investigation into the outbreak. A joint advisory from the NCDC and the NCVBDC is being issued to guide the neighboring states reporting AES cases. Now, Chandipura virus was first isolated in 1965 in the Indian state of Maharashtra from a patient suffering from the febrile illness with the ability to produce cytopathic effect in cell culture. Chandipura virus is a member of the genus vesicular virus in the family Rhabdoviridae. Later, it was also isolated from the encephalopathy patients in the 1980s. However, the first evidence for Chandipura association with human epidemics was obtained in 2003, when this virus was identified in patient samples during an outbreak in India as a determinant of the acute encephalitis with a high fatality rate, claiming 183 lives, mostly children under the age of 12. The medical examination of patients recorded high-grade fever, occasional vomiting, rigors, sensorium, drowsiness leading to coma and death within 48 hours. Subsequently, another outbreak of Chandipura infection with more than 75% fatality rate was reported in the eastern region of Gujarat, India in 2004. These recurrent occurrences indicated possible emergence of Chandipura virus as a deadly human pathogen in the Indian subcontinent, causing acute encephalitis syndrome and involving severe human pathology, which progresses rapidly from an influenza-like illness to coma and death. Female sandflies of the phlebotomine genus, ticks, and mosquitoes are proposed to be the carrier of the virus, wherein this arthropod virus resides in the salivary glands of these insects and is transmitted to the mammalian host through bites. In the family Rhabdoviridae, there are 10 genera, with the genus Lysovirus and the genus Vesicular virus being of public health importance. Many of you may know that rabies virus, the prototype virus of the genus Lysovirus, is the most important pathogen of Rhabdoviridae with a worldwide distribution. Among the vesicular viruses discovered so far, Chandipura virus is considered to be the most significant pathogen of public health importance due to the high case fatality rate. While prevalent in tropical and subtropical regions, Chandipura virus poses a serious threat to public health in the entire Indian subcontinent. Notably, with an increase in travel and globalization, viruses are no longer restricted to national boundaries. Now, the typical clinical manifestations of Chandipura virus include rapid onset of fever, a fever that is followed by vomiting, altered sensorium, which is a change in mental status or consciousness, convulsions, diarrhea, neurological deficit. Examples may include the inability to speak, a loss of balance, and vision changes. And you may also see meningeal irritation, which may show as signs including headaches, neck stiffness, photophobia, and seizures. As I said earlier, the Chandipura virus has been found to be affecting children under the age of 15 predominantly, and predominantly in rural locations. There is no specific antiviral agent to treat Chandipura virus, and there is no vaccine available as of yet. Early diagnosis and treatment are key. Management of the disease includes managing airways, breathing, and circulation through oxygen therapy and ventilation. Management of fluid and electrolyte balance, hyperprexia, which is a condition where the body temperature goes above 106.7 degrees Fahrenheit, raised intracranial pressure and seizures, and prevention of secondary bacterial infections are key. Prevention of Chandipura virus include vector control, identifying sandfly breeding sites, spraying insecticides, sanitation, environmental control, including the proper storage of disposal of waste and refuse, stopping open air defecation, and the use of flypaper. Breeding sites include holes and crevices in walls, holes in trees, dark rooms, stables, and storerooms. Prevention of bites is also important through the use of protective clothing, repellents, and nets. Thanks for listening.